Hi, my name is Annette Sikorsky, and I'm currently the clinic charge nurse at the UVA Cancer Center over in Fishersville. Um, Previous to that, I was an infusion nurse at that same location, and prior to that, I was an inpatient oncology nurse and stem cell transplant nurse. Um, in all of the roles I've been in, having effective interprofessional communication is imperative, but in the ambulatory oncology setting and infusion setting, it is just imperative. And so that is why I have selected implementing effective interprofessional communication as my practice change for my paper. So, in a nutshell, the problem is that we have gaps in communication that sometimes occur between the clinic setting to the infusion setting. And even though we're within the same building, there's a lot of information that can get lost in translation. As nurses, we think that the physician will relay to the infusion nurse, and sometimes that's not always true. And so the impact of this is delay in patient care, miscommunication on a patient or their status, increased frustration between nursing and support staff, and then patient safety concerns as well. So the goal for this is to create a well-oiled machine by improving collaboration between both the clinic and the infusion side, clarifying roles and responsibilities, especially when it comes to scope of practice, and establishing reliable communication pathways that can be used on a regular basis and people know what communication pathway they should select for what the problem at hand is. So as far as strategies for change, the first strategy that I had come up with was to define roles and responsibilities, especially because we have several different tiers of staff that work in our setting. We have everything from RNs to LPNs and then to CMAs. And everybody has a little bit different of a scope of practice, and so ensuring that everybody understands what each person's job is. Even within the RN setting, there are different pathways of RNs. There's like a more clinical side, which is our clinic staff that access ports, that prep a patient for and draw their labs or place IVs. And then there are also RNs that focus more on triaging and in-basket messages. So not everybody, just because they are an RN, automatically means that they are clinical or have been taught the skills that are needed to take care of our patients. And so just understanding everybody's roles, responsibilities, and the scope of their practice is so important for that reason. That way we're ensuring that we're asking the right people for the right job, especially because between LPNs and RNs there are so many similarities, but there are still some very distinct differences when it comes to medication administration and things like that. The second strategy for change that I had come up with was the utilization of the Vocera paging system and Vocera badges within the clinic setting. Our clinic is pretty big and it is expanding in the near future, so having Vocera badges is something that was very helpful when I was an inpatient nurse, and it's helpful. I find it will be helpful in our setting now, even for just having a quick communication system between the infusion side and the clinic side. We can quickly send somebody a message, quickly call for help if we are in a room and need some assistance. And then the Vocera paging system allows the infusion nurses to contact the doctors in the same way that they would contact any other doctor on an off-site instance. So providing that paging system as a reliable communication pathway is important. Strengthening clinic and infusion relationships is the third strategy for change. So just understanding that we are a cohesive team, and even though we have different roles and responsibilities within those two settings, we're two arms on the same body, and so we are handing patients off as smoothly as we can to one another, which is extremely important in this setting. And having that good working relationship helps to ensure that there's nothing missed or nobody is hesitant to tell somebody something they need to really know, especially when it comes to patients. So having joint meetings and things like that is a good way to implement that. Number 4 is structured escalation pathways, and I think part of this is knowing as an infusion nurse what constitutes for an immediate interruption. Even though our providers are on site and they're accessible, that doesn't always mean that they have time to stop seeing patients in the clinic setting in order to just walk over to the infusion center and mitigate a problem. Of course, in certain emergent circumstances, that's absolutely an appropriate solution. But when it comes to things that could maybe be handled in a little bit different of a manner, if patients need refills, things like that, these are all things that can be placed into the Epic in basket and then sorted out by our triage nurses. If it's something that affects a patient in the immediate sense and may affect whether or not they received their treatment, that is an important thing to take into consideration as an infusion nurse. And like I stated earlier with the Vocera paging system, having that also as a structured escalation pathway helps so that a doctor can be aware of something, but they also have the option to just quickly glance at a message and decide if they need to leave their visit with a patient that is here in the clinic setting right here and now. The structured escalation pathway also helps to limit interruptions for nursing and care coordination as they are jumping from task to task as it is, and so interrupting that process sometimes can be very detrimental and lead to mistakes when doing important things like building out plans of care for patients. My fifth and final strategy for change is also something we try to use daily, but the consistent and accurate use of the Epic status board. This allows everyone in the clinic to know what patient is in what room or what infusion chair, and if they've already been gotten, if they are still sitting in the room, let's say, after their visit is over, we can then know to go check on them and make sure that they have everything they need so that they can either move to the infusion site or leave our clinic. So their timeline for implementation. So month 1, we can use to assess current state, see where we're at, what staff feel the biggest communication challenges are. And then also in the first month, start to educate staff on roles, scope of practice, and our escalation pathway options that are available. And then also in the first month, training staff on the status board expectations and the usage with a color-coded guide that indicates where the patient is in their visit. For months 2 and 3, we can roll out the Vocera badges and paging system and really start to hone in on using those as a main form of communication. And then also begin joint staff meetings to reinforce our interdepartmental collaboration. And also allowing for open discussions to address staff questions, concerns, or any feedback they may have at that time. Months 4 and 5 are about formalizing structured communication and escalation pathways, so really adhering to those things and reminding people to use the correct pathway for what their given situation is. And then conducting staff surveys on the effectiveness of all of the changes that have been implemented thus far. Also, in months 4 and 5, we can collect more data on provider interruptions and evaluate the appropriateness of these interruptions, along with care coordination, same thing. For month 6, we can evaluate this initiative's success using survey and data results among staff. So really just seeing if anything has shifted from the beginning before these changes were implemented to now. And then comparing them with the baseline findings that we had originally come up with. And then adjusting strategies as needed for continuous improvement. That's always going to be something where we can always grow and learn. New pathways for communication may come up, and that would also be available to be implemented if necessary. So for areas of support, from a leadership perspective, administrators and charge nurses and providers as well, we can all agree that smoother operations within our clinic setting and infusion setting, and an increase in patient safety as well. That's a huge plus for those people. Infusion nurses are probably going to get quicker responses to their questions in a more appropriate fashion, and have more time to care for their patients appropriately in the one-on-one setting and during the infusion time. For providers, their huge benefit is obviously less interruption and more structured communication, and also it clarifies the expectation from them, and what they should be doing to support nursing. And then for our patients, of course, we can assume that they would be a big indirect supporter, which is shown through patient satisfaction scores and improved care. Areas of resistance, so some staff who have been here for a long time might be resistant to the new technology, especially with the Vocera, because their thought process is, oh, I can just walk across the hall and have a face-to-face conversation. But understanding why things need to change is a big piece in that, so education is going to be a real big part of that. And then perhaps some staff might have some concerns about the amount of time we spend in meetings or conducting surveys, or if it's going to contribute to additional documentation. And then for expected outcomes, safer, more efficient patient care is like the bottom line. That's like the number one goal of this change. Having stronger teamwork and job satisfaction for both infusion nurses and clinic nurses and staff. Higher patient satisfaction and Press Ganey scores is another hopeful outcome for this. And then as we expand and see more and more patients in both the clinic and infusion settings, having better preparedness for all the patients, the influx of patients we're about to see. So communication is the foundation of safe and efficient oncology care. And this 6-month plan ensures realistic and sustainable change. And so if we commit to structured communication and clear communication now, then we can guarantee safer and more efficient care in the future. Thank you.